what we'll probably do is kind of, you know, two of you can be at the bed and chair, and then I'm going to have just like, well, practice chair to chair while everyone else is doing it, so you don't have to all do it. You don't have to watch everyone do a bed to chair transfer. Just, I really want to see your body mechanics and making sure that you're doing the transfer the right way. You grab more chairs. So maybe we'll make like, I'll just split it into groups of 2 for right now.
How many chairs do you want?
You sure you need that up?
So you 2 will be together, and you 2 together.
Sure.
And then we'll all work together. So just the 2 right here for now. Y'all can sit or stand or do whatever you want to do. Okay, so can I have that? Okay, so we're just going to start with a simple bed to chair transfer using the gait belt. One of the things that, especially the PCTs and the nurses, they're going to be on the floor here. One of our big pet peeves is when we see someone transferring a patient without a gait belt. You never ever want to grab someone by the underarm. Okay, these older patients are, you know, they might have a rotator cuff tear that you don't know about or something going on, and it's just not safe to grab someone by their armpit, and that's why everyone gets a gait belt. So keep it on your body when you're working the unit, or at the nurse's station, or on your cow, just so that you have it. Don't keep it in your locker, because this is going to be the safest way for you and for the patient to get up. Okay. So pretty easy. The gait belt works just like a seat belt. You just unclip it and fasten it, and you want to make it snug around the patient. So you're going to be my patient. And you'd like to tell them what you're doing, okay? You're going to come in either around the waist, or sometimes you have to go above the chest. If they've had any type of incision or colostomy, you want to make sure that you're not putting the gait belt over that, or any IV lines or any tubes, anything like that. You just put it pretty snug, tighten it, cinch it. You want it snug, you want it tight, so that you can only fit about 2 fingers underneath the gait belt, okay? If it's too loose, it's going to come up right up over their shoulders, and it's not going to help you. They're going to be leaning forward when you try to pick them up. So nice and snug. Let them know that it has to be snug. They're going to say something like, that's too tight, loosen it, but it's for your safety and for the patient's safety, okay? So that's using the gait belt. Now, when you're in the patient, let's have you go to the bed, Cody. Yeah, to the side of the bed. And you've helped the patient up, you've helped them to the edge of the bed. What you're going to want to do is set up the room so that the transfer is going to be easiest for you and for the patient. So if the chair is way over here and you know the patient is a max or total assist, you want to set up that transfer so it's easy for you. Does everybody know what min, mod, max, total assist means?
I don't know what mod means.
Okay.
Moderate, but I mean, what's
Okay.
the difference between that
And a min,
minimum?
okay? So a min assist is you are only having to help the patient about 25%, and they can do 75% of the work. Mod assist is 50-50, so you're helping them either stand or transfer 50%. Max is 75-25, and then total assist is they're not helping at all. You're doing all the work for them, or maybe you need another person to assist with that transfer, maybe with their upper body or their legs.
Okay.
So that's min, mod, max. And you'll see us, if physical therapy is following in the room, we'll write that on their communication board, how much assistance they need. And then you can always ask us, you know, a max or a total assist. We don't recommend that, you know, staff, like nursing staff does that on their own. Always have another person in there to assist you if you can. And if you don't feel comfortable with the transfer, don't do it by yourself. It's not worth you putting yourself at risk and then you're out of work or harming the patient. So just always err on the side of safety and caution there, okay? So we're going to pretend that Cody's a min assist first, okay? So he can stand, he can walk, he can get up to the chair. Doesn't take much help, okay? So you're always going to get nice and close to them. Grab the gait belt with your palm facing up. Get really close to their body and just kind of cue them. Tell them what you want them to do. Give them simple instructions. So Cody, I'm going to have you stand up for me, and we're just going to walk over here to the chair. And I never let go. So if I was on the wrong side of him, I just let him walk in front of me and hold on to the gait belt and never let go of that contact with him, just in case he might fall. I'm going to have you reach back for the armrest and go ahead and sit down and have a seat. Okay? So that's min assist. Now also he could be using a walker, and if you know that they have a walker in the room or he's used a walker beforehand, go ahead and use the walker to help him to the chair. Okay? So mod would be 50-50, right? And then a max or total assist. I'm going to kind of go through that. I'm just going to have you get back up to the bed. And so if the patient got up and he's kind of down here at the edge of the bed, you can have them scoot up. Sometimes they can't even scoot up to the side of the bed. Cody can, so that's good. And if you know that this 2 feet distance is too far for them to go, they can't even walk that much, then you want to just get the chair as close to the bed as you can. And you're always going to want to transfer to the strong side if you can. So if you know maybe that patient is a hip fracture and they fractured their right hip, try to put the chair to their left side so you can change the room around to make it safe for you and for the patient. Right, so that gives you less distance for them to pivot so they can pivot onto the strong side and just go to the chair. Okay, does that make sense? So a max assist, what I would do, or max or total assist, is I'm going to get down right close to him, right up in his personal space, okay? And my knees are going to be blocking his knees. So I'm putting my knees right in here next to him. They're going to be kind of on the outside of his knees. So everyone kind of see that? And I'm going to squat down, so body mechanics is really important, especially when you're lifting up a big guy or even these little ladies that try to push against you and they resist your motion. You're going to squat down like you're sitting into a chair. You're going to grab the gait belt, again, both hands, and it's going behind him with your palms facing up. And you're going to have them help you as much as they can, so having them rock towards you, okay? And always keeping your knees here so that if he does happen to go down, you can push him into extension with your knees and push him back to the bed or guide him to the chair. Okay, you ready, Cody? So we're going to transfer to the chair. What I want you to do is just rock back and forth with me. Okay, once you stand up, I want you just to grab my forearms. Okay, never ever let a patient grab you around the neck, because that can hurt you. Okay, so the only place I'll let a patient touch me is the forearms. Right, so are you ready, Cody?
Yes.
Okay. Go on, break. 1, 2, 3. Okay. So you saw that I tried to stay as low as I can. That wasn't probably the best transfer.
Test page.
But my knees were in line with his, and I helped guide him with my knees to the chair. Okay, makes sense? So same thing, a max or total assist might be that. And that's called a squat pivot transfer. So he doesn't stand the whole way up. We just squat and he pivots to the chair. Okay. Now a stand pivot transfer is if he could stand up with the walker or with assist and take a couple little steps, but he still needs, max assist to maybe stand and take those few steps to the chair. Okay? So I'm going to have y'all kind of split up into groups. Go ahead and put the gait belts on. Practice that. Okay? Practice a min and a max or total assist transfer. Okay? And I'm just going to be around to watch y'all. You want come over here, Erin.
Kind of snug, huh?
You be patient so I can watch you. Oh, come on now.
Switch over to the other chair. I'm going to put this around here. Sitting on the pillow.
Okay.
Okay. Reach back.
I'm gonna have y'all just practice with the walker because you'll especially when you're working for a store.
Chair,
A lot.
stand up.
Are you gonna do a pillow assist first? Okay, when you're done with that, then you switch. Okay, okay.
So what we're gonna do here is I'm gonna put my knees over against you here. And then you're gonna do the max also.
Yes.
And I'm gonna grab. Right?
Yeah, try it.
And we are gonna
Did that go okay?
Yeah.
Okay.
So, is that a good one for you? We're gonna do.
Yeah, if it gets in your way, tuck it in, yeah.
This is.
You're tall, yeah,
Forearm.
exactly, so, yeah.
Okay, so I'm gonna help you over here.
Okay.
I'm gonna rock you forward a couple of times and you can stand up and I want you to put your hands on my forearm. So that will get you over.
So we're gonna try the walk now?
Yeah.
Good,
Good.
that was good,
Real good.
yeah.
Okay, what else do we need to do? So what?
I said those were the things that were my knee here, keeping your knees around me.
Bed sores.
Yeah, I was trying to follow.
Okay, did you want to do anything
Good.
different with the walker?
So let's pretend you're mid-assist.
Okay.
You're able to take a few steps with the walker.
Okay.
So one of the things that the patient's always
Yeah.
wants to try to do is grab the walker first and stand up, and that's not a safe way to do it. So make sure that you tell them push up off of the bed or off the chair, that's the more stable surface, and then grab the walker. Exactly.
Now, how does he grab this and be able to get into that space with this right here?
No, if you're minimal assist on this one,
You don't have to.
so I'll be on the.
Right,
side.
he just needs to get as close as he can to you,
Okay.
and then you stand up,
Oh, you're-
push from the,
You're not gonna hold, you're gonna just push from the bed.
Oh,
One, two, three. Okay, now go ahead and grab the walker. What we're gonna do from here is you're gonna pivot around.
Okay.
And I'm gonna stay with you the whole time and we're gonna go into the chair. Okay, so you're gonna go ahead and let go of the walker and you're gonna reach back for the chair.
Good. Good. That's good. Okay, any questions on that? Y'all feel comfortable? Pretty easy. Again, like I said, if you need help with the transfer, we are here. If we're following that patient, we don't mind helping with that, as long as maybe you've tried it once already. If it's a min assist, we hope that you can get them back to bed by yourself. If it's a max or total assist patient, we don't ask the nurses to get them back to bed, unless for some reason, that you needed to get them up, you're working a night shift and you had to get them up, well then we're not here. So we want you to be able to know how to do it safely and comfortably, but if it's someone that's a harder transfer, we're not gonna ask you to do that, okay? So,
Max assist with the walker or no?
yes, it happens, yeah.
How do you approach the front of the walker?
You do the same,
Really?
so let's do a max assist with the walker. So that tends to happen when you have a patient that had a hip fracture and they have weight-bearing precautions like touchdown weight-bearing or partial weight-bearing, that they can't put a lot of weight on their leg, and then that you really have to help them stand, okay? So, and everybody's max assist is perceived a little bit differently. My max and your max might be a little bit different, just depending on how strong you might be or how the patient's doing that time when you go in to see them. A max assist is the same thing. You guide them through, you give them the same cueing, you're just giving them more help to stand up, okay? So try to be max assist for me, okay?
No pushing up on the bed then?
Push up with your hands, help me how you can, but maybe your legs are really weak, okay?
Right.
So you're grabbing hold of the back of the gait belt, same type thing. Sometimes I'll hold on to the walker in front of them if I know that they're gonna grab onto the walker, or you just stay right close to them, put your hand on their shoulder, and you help them up. You give them that cue at their shoulder, go ahead and grab the walker. And I'm just, she's being a max assist, I'm holding her up by this gait belt, and then I'm gonna have you lift your head, okay? Pull your belly button forward, tuck your butt under, so you're standing up nice and tall, okay? So, really max assist is the amount I'm helping her to balance while she's standing, okay? Now she could take a few steps, but maybe she's really unsteady, okay? And you go ahead and move the walker. There's nothing wrong with her arms, it's just her legs. So then I put another hand on front of her, and I just keep my body as close to her as I can the whole time, Okay, then I'm gonna have you reach back for the chair. Sit down nice and slow. And I hold on to that gait belt until they're sitting so she doesn't plop down into the chair. Does that make sense? Okay.
Just stand as close to the wall.
Yeah, you want your body, you want to be right up in their personal space, because if they're out, you have your arm out like this and they go down, you're getting hurt and they're getting hurt, okay? So that way, something happens, you have both hands right there on them that you can help them.
So why would I want to use the walker if doing a max assist the other way is so much easier for me and them?
Well, because then it's easier for you, but the patient's not getting any benefit. If I'm lifting that patient up and putting them into the chair, I know that patient can stand, I know that patient can take a few steps, then why don't I have them do that? Let's have the patient do as much as they can. That's the reason they're here, to get better. We're not here to do the work for them. I understand, and a lot of times with nursing, that's going to happen, and that's okay, because that's our job to help make them stronger. So if you're in a huge rush and you know that transfer is going to take 20 minutes just to do a couple little steps, then by all means go ahead and do that squat pivot transfer, and then we'll work with them later to work on those transfers. Okay, does that make sense?
Yes, ma'am.
But you know that patient's able to walk, they just might need their balance is off and they need to move, and they can use the walker. Then let them do it, you know. Okay, good? Okay, take your gait out now. Okay, so we're gonna go through Hoyer lifts real quick.
I think I put this in.
Okay.
You want me to put it
Yeah,
up here?
yeah, you don't need it right now. Y'all can take off your gait belts. You won't need those for this next section. Has anybody ever used a Hoyer lift before? Okay, somebody has.
4 points on it though. Someone has 6 points.
Yeah, everyone's different. In the office, there's a sling that goes with this.
Okay.
If Jana's in there, she should know. Ask Jetta. I think it's above Jetta's head. So yeah, every sling is different, and what happens a lot of times, we'll get, actually I've gotten calls in imaging for a patient who came in from a nursing home who needed the Hoyer lift. She had her own sling with her, but her sling does not work with our Hoyer lift. So they called us downstairs to help her. We had her kind of stand up in her wheelchair. The therapist helped her stand, and we put our sling underneath her. Don't try to use another sling that doesn't go with this Hoyer lift, because it's not rated for it. And it did, like, it had 6 loops instead of 4, and it would have been a big mess. These slings are disposable, and they're kept in the Omni cells, and if a patient needs the Hoyer lift, they get their own sling, and then that sling is kept with them until they leave, and then it's thrown away. Okay. So we're going to we'll breeze through a lot of this stuff. Who wants to, Cody, you want to do the
Sure,
patient again?
that's fine.
Okay. So we're going to pretend like we've already rolled this underneath him. This is for a total assist patient that cannot stand up, has no balance, cannot walk, maybe has been wheelchair bound for a few years or months, something like that. You're going to use the Hoyer lift arm. So, Cody, by magic of we've already rolled, you go ahead and lie down in there. What you want is, maybe scoot down a little bit more.
Yes.
You want this to be right underneath the crown of their head. If you have it too high or too low, you're going to have to do a lot of adjusting once you get them in the Hoyer lift. So again, remember, we've kind of rolled the patient, we rolled this underneath just like you would a drop sheet. Okay, so I know y'all are experts at that. I'll save that time with that. You take the Hoyer lift and you're going to bring it, again, get the room set up. The most of the time is just going to take, situating the room and moving things around in the room. You line it up right at their waist. Try not to hit them with the Hoyer lift down there. The on-off switch is right here. It's a green button. You just press it in and then press the remote. Any button on the remote will turn it on. Okay. If it doesn't come on, it means the battery's dead, and then this is the battery. We have to keep an extra one in the hallway, and I'll show you all where that is later on. Okay. And then it's pretty self-explanatory here. There's just pictures. The boom goes up, it goes down, and it's going to rotate forward or backward into like a chair position. I'm going to raise this up so I get that out of his way first. You want this little part, this stem, to face outwards. and then you're gonna line it up as best as you can and lock the brakes. Now this Hoyer lift is rated for 500 pounds. You'll notice the slings are kind of small. They are rated for that weight, but soft tissue of 500 pounds probably is not gonna fit in that type of sling. So just be aware of that. This part is gonna go underneath his leg. And then Aaron, I'm gonna have you come over on the other side. Please. And go ahead and put that underneath his leg. Okay. And you're gonna clip this on right there.
How did I do it? Was it just like a slide in?
Yeah, it's just a big hole at the bottom and a smaller hole at
I'll
the
have
top.
y'all do the top ones then, so we can move.
Does this go under the arm
Nope,
or top of the arm?
that goes on top. So it's gonna go, we need to get this down here first, hold on. So bring the boom down so that, and then you're just gonna attach this right to this silver thing. And it's always good, one person could feasibly do this by themselves, but it's always good to have another person just to see what you're doing.
Wow.
Here, let me move it for you for a little bit. There you go. And this can be adjusted so you don't have to pull it so
Okay.
hard, so, okay? So you just want to tell the patient what you're doing. They're going to be nervous, especially if they've never been in a Hoyer lift before. Watch out for catheters, watch out for IVs. The catheter I usually just kind of clip it under that hole right there, but make sure that it's not clipped underneath the sling. So, Cody, we're gonna just raise you up, okay? This sling is gonna support you. I just want you to try to relax, take a deep breath, and just keep your arms across your belly, across your chest, okay? And we're gonna go up. And just press the up arrow until you can clear him from the bed. Okay. Move the chair and kind of right up against the bed here.
Want me to lock it?
Yes, please. And Erin, can I have you come over here again? Can I have you guide his knees and turn him towards me? So make sure his knees don't hit. And this is the hard part right here. Try to get them up into a seated position the best you can, because you really have to put them into a lot of knee flexion right here to get them past this bar. And that's probably one of the hardest parts with the patients, is the bend. And then you just guide them over to the chair. So if y'all can watch for me, because I can't really see where I'm going.
Okay.
And you can open up these legs.
Let's back up just
Okay.
a little bit and we'll get outside the wheels. A little bit more widening.
This side.
Okay. Alright, so pulling you back into the chair.
And are we good there?
Good.
Okay, we're going down. And so all,
Come a little more my way. Will it push any further or is it?
I can't get any closer to you. It's as wide as the, let me see, yeah. And you just use the arrows on the remote, okay? So once he's in, you can unhook the sling.
A little bit more.
Is that sling one size fits all?
Yes.
Because he's small. I mean,
Mhm.
for the majority
And
of
then they just sit in it until we're ready to move them again.
Correct.
Okay.
But don't leave them in the bed in that. They can sit up in the chair with that, but once they get back to bed, make sure you take that out from underneath them. Okay. Yes, they are one size fits all. That's a good question to ask about maybe getting some bariatric sizes ordered. To be honest, I don't know if we have any of those in the house.
And if that's
So-
capable of doing 500 pounds, you want a bigger size.
Correct, correct.
Is it 500 pounds?
Yes. Yep.
You
Okay.
know how to use one higher than 500 pounds?
No. It would have been nice. I've had patients over 500 pounds here that would have been really helpful for me. Yeah, absolutely. But I'll show you another little thing that we have. It's not for chair. It's not for bed to chair transfers, but it's for bed to bed or bed to gurney transfers. So that's the next thing that you get to go over. Okay. Any questions about the Hoyer? It's simple. It's super simple, but people, I think, after they don't see it for a while, they get afraid, like, oh, I don't know how to use that because I've never used it. But the picture, there's actual physical pictures on here too. So in case you forget, they're on
Can you
this.
just turn it off to save the battery? Is that fine?
Yep, turn off, red button. Okay. This will also weigh it. If you have the patient in the sling, you can also get a weight on them too. So, okay. So this, has anyone ever seen an air pail at another place? Okay. Now this I've used to get a patient that could not stand. I think she had an amputation and we couldn't get the prosthetic on. She was swollen and we couldn't get her to a chair, so we used the air pal to get her from the bed to a cardiac chair. So everyone knows what a cardiac chair is. It'll lie flat and then you can put them upright in it. So it's like doing a bed-to-bed transfer and then they can sit up in the seated position. So we're going to pretend again like we rolled this underneath Cody once I get this on the bed. The light blue side, if you forget this too, light blue side is the side that you went down. It has little tiny holes. It kind of looks like an air hockey table on the underside. And it's almost the same idea. This thing is going to blow air up into this mattress and allow us to pull the patient across the bed without much effort. Okay? So it looks like a crazy little vacuum cleaner. You just want to plug it in. And this is up to 1,000 pounds. So, and then on the end here, you'll see a little opening with a snap, and you just put that hose in. Snap it in. These little buckles, so Erin, could you sit on the other side for me? That you're going to strap the patient in. You don't have to pull it real tight right now, but okay. So you strap them in and you're going to tell them what you're going to do. This mattress is going to make a lot of noise when I turn it on. And it's going to blow up air around you, okay? So don't be afraid. You're going to be nice, safe, and supported. You're strapped in, okay? So I'm going to turn it on. You just hit the gray button.
With air that your side wheels are up.
Yes, I would, yeah. Unless you have people, and I usually have three people helping me with this, 3 or 4 if we're going from bed to bed, and just have people around you. Yes, yes. And so, get them into the cardiac chair, that this can stay underneath them in the cardiac chair. Another simple thing, just think about what you're doing beforehand. If they are in a seated position, make sure they're lying down before you blow this up. Does that make sense?
Yes.
Right, otherwise it's like a slip and slide out of the chair, okay? Any questions about that? It's pretty simple, pretty easy. But remember that these tools are here for you. So even in imaging or wherever you might be working, if you get a patient that you can't transfer, come up to the floor and, you know, if you don't know, if you've forgotten where we keep them, ask us and you can take this down to wherever you're working and use it so that you protect yourself, okay? All right.
And this one is a reusable one, right?
So this one, this top thing, it can be taken off and just wipe it off with the purple wipe. It can be laundered, but we don't want it to go in the laundry because we'll never get it back. So just wipe the whole thing down with the purple wipe when you're done using it. Okay? All right. So that would be, you know, this would be something that you would use on your sheet. I think you have like a 3 or 4 person transfer. Y'all know how to do that bed to bed, and this would be something that you could use for that too if you needed it. Okay? I think that's it. Any questions of the transfers? Okay. So remember body mechanics, and if you don't feel safe doing it, don't do it. I think those are the 2 most important things to remember. Okay? All right. So I think I have to sign off something in your folder.